Good morning, students. Greetings from Department of Orthodontics, SRM Dental College, Ramapuram, Chennai. In this educational video, you are going to learn how to assess the skeletal maturity using a hand-wrist radiograph. What is skeletal maturity? Skeletal maturity is the measure of how much a person's skeletal development is completed. It can be assessed by comparing the size, shape, and degree of mineralization of a person's bone. Why assessment of skeletal maturity is important in clinical orthodontics. Clinical decisions regarding the correction of skeletal malocclusions are based on the skeletal maturity of the individual. Growth modulation procedures such as orthopedic and functional appliances are suggested to be initiated during active growth, whereas orthognathic surgeries are recommended when the patient's skeletal development is completed. The various structures in the body whose developmental stages can be used to assess the stage of development of a person's overall skeletal development are known as skeletal maturity indicators. The commonly used skeletal maturity indicators are hand-wrist radiographs, cervical vertebrae, and stages of tooth development. The hand-wrist radiograph is considered to be the most standardized method of skeletal assessment, where the assessment is based on the time and sequence of ossification events in the carpal bones and phalanges. A number of methods have been described to assess the skeletal maturity using hand-wrist radiographs, including the Atlas method of Grulich and Pyle, Bjork, Grave and Brown method, Hag and Turunger method, and Fishman's method. Out of which the Fishman's method is more commonly used, because of its reliability and reproducibility. The Fishman's method was developed by Leonard S. Fishman in 1982. Fishman focused on the developmental stages of key anatomical features like the phalanges, finger bones, the radius, and the adductor sesamoid bone and gave 11 stages, which correspond to distinct milestones in bone development during a patient's growth. These stages provided a reliable indicator of skeletal growth, with emphasis on maxillae and mandible. To be able to assess the skeletal maturity using a hand-wrist radiograph, we need a basic knowledge on the bones of the hand and wrist, their ossification stages, and the 11 stages of Fishman's index. Let us see them one by one. First, let us see the hand-wrist. The hand-wrist consists of radius, ulna, 8, 5 metacarpal bone, 1 for each finger, with 3 phalanges in each finger except the thumb where there are only 2 phalanges. The thumb is designated as first finger, with the middle finger as the third and the little finger as the fifth finger. The phalanx at the tip of the finger is the distal phalanx, and the one near the metacarpal bone is the prophalanx. 2 sesamoid bones, one in the adductor ligament and one in the flexor ligament of the thumb, are also seen. These are the line diagrams of how the salient stages of Fishman's method look in the radiographs. First row consist of the pictures of a phalanx at various stages of development, wherein for the picture, the epiphyseal cartilage width is equal to the width of the diaphysis. In second row, we can see the capping of the epiphyseal cartilage over the diaphysis, and in the fourth row, the various stages of fusion, with the last picture being that of complete fusion of the cartilage with the diaphysis. The last row shows the ossification of the adductor sesamoid of thumb. The Fishman system of interpretation divides the maturation of hand-wrist into 11 stages based on the radiographic findings, and correlates it with the percentage of skeletal maturation remaining. The width of the epiphysis equal to that of diaphysis in the proximal phalanx of third finger in stage 1, middle phalanx of third finger in stage 2, middle phalanx of fifth finger in stage 3. The appearance of adductor sesamoid corresponds to stage 4. The capping epiphysis in distal phalanx of third finger is stage 5, the middle phalanx of third finger is stage 6, middle phalanx of fifth finger is stage 7. The Fishman system of interpretation divides the maturation of hand-wrist into 11 stages based on the radiographic findings, and correlates it with the percentage of skeletal maturation remaining. The width of the epiphysis equal to that of diaphysis in the proximal phalanx of third finger in stage 1, middle phalanx of third finger in stage 2, middle phalanx of fifth finger in stage 3. The appearance of adductor sesamoid corresponds to stage 4. The capping epiphysis in distal phalanx of third finger is stage 5, the middle phalanx of third finger is stage 6, middle phalanx of fifth finger is stage 7. Stages 1 to 4 are ideal for growth modification of maxilla, including expansion, maxillary growth restriction with headgears, and maxillary protraction with face mask. Stage 5 and 6 are ideal for correction of skeletal class 2 malocclusion due to mandibular retrognathism with functional appliance, and stage 7 to 10 for fixed functional appliances. After which the skeletal malocclusion cannot be corrected by growth modification procedures. This picture shows the schematic representation of the method that can be used for the interpretation of a hand wrist. Now let us see how the scheme can be used for the interpretation of this hand wrist slide radiograph. The first step is to look for the appearance of adductor sesamoid. In this radiograph, the sesamoid is not seen. So now we are checking the epiphysis width of the proximal phalanx of third finger, whether the width is equal to the diaphysis. Yes, the width is equal, so probably the maturation stage of TIS radiograph is stage 1. Just to confirm, check the middle phalanx of third and fifth finger. The width of the epiphysis is lesser than the diaphysis, hence the maturation stage of this hand wrist is confirmed as stage 1. So now what do we infer from this? The stage of skeletal maturation is 1 and more than 85% of skeletal growth is remaining. Maxillary expansion, protraction or retraction with orthopedic appliances can be performed in this patient, and this stage is too early for mandibular growth modification. Now let's do another interpretation. Here is a hand wrist where the adductor sesamoid of the thumb has appeared. So now, following the scheme, we are looking at the distal phalanx of third finger for fusion or capping, when neither had occurred. The middle phalanx of third finger and fifth finger are examined for capping. When the capping was noted only in the middle phalanx of third finger, stage 6 was assigned to the hand wrist. 25 to 65% of growth is remaining in this patient, and this stage is ideal for correction of mandibular retrognathism with functional appliances. Here are a few radiographs for your practice. Take a screenshot and try to assess the skeletal maturity. And time for some extended learning. If you are an inquisitive one, find out why radiographs of the left hand wrist are used for assessing the skeletal maturity. Thank you, have a good day.